My name's Katie McClure. I'm the current chair of British Computer Society Health and Care Scotland. And Sharon's on here as well. He's the current treasurer and past chair, and he's admitting everybody into the meeting. We're absolutely delighted to have Roger speaking for us again. He's done excellent talks with us before and always has really interesting things to say. And we're all desperately interested in how he's going to manage to unlock the data, because it's what we all want and we'll try to get a hold of, and the foundation of all our evidence-based research. So there's still more people coming in just now. So I'll just let you know, we're aiming to run events like this. Every last Tuesday of every month is what we're aiming for, except I forgot the last Tuesday be next week. So I went for the 23rd instead of the 30th. But we do have there's a talk coming up next month, and it's on counter fraud, awareness and practice in the NHS. And there's a counter fraud specialist speaking for us there, Gary Watt, a colleague of mine. But I see the numbers are going up rapidly, but still coming in. So I'll just say again, you're at the British Computer Society Health and Care Scotland webinar with our speaker, Roger Halliday, Chief Executive from Research Data Scotland. And I think we'll get started. Everyone, we are recording the event. The recording will be available afterwards. It'll be on our past events page on BCS Health and Care Scotland. And I think the link is going to get sent out to you for the recording to everybody that's attending. So with no further ado, Roger, I'm going to hand over to you, and your slides worked before. So here's fingers crossed, and they are there. So over to you, Roger.
Okay. Hi, everyone. Well, Katie, many thanks for inviting us along to speak today. It's always good to connect with such a austere group as this, and a really important group for me in doing what I'm going to be talking about: unlocking data for research that improves health, well-being, and care. And conscious that some of you will have heard bits of this, some of you won't, but my role here is the Chief Executive of Research Data Scotland. So I'm going to be saying a little bit about what Research Data Scotland is, why we want to do this work, where we've got to, and what we're doing next. And if you've seen me before in other roles, it was probably as when I was the Chief Statistician for the Scottish Government and for Scotland, or the Chief Data Officer for the government, or in the context of when I was head of the COVID analytical team in government as well. And I suppose each one of those roles recognised that there was benefits from enabling existing data to be used more widely for research and analysis, in particular, sort of connecting data around a person or in other context, a place or a business. I'm going to talk through the things that I outlined there, and perhaps get some views from you about some of the key research data gaps that we've got, and how we can sort of best make researchers aware of the new service. Michael, I've just noticed you were requesting remote control of your screen. Yeah, I just wondered if there's anything that.
Oh, I'm sorry, I didn't mean to do that. Okay,
no worries. Okay, let's move on. Yeah, so I suppose I mentioned the COVID pandemic here, and there's a couple of quotes from one of the things that really cemented the need to make data available, it's kind of to reuse and to link up data is around the pandemic. And so the person on the left is Ian Diamond, who's the UK's national statistician.
Today, Junior.
Yeah, it'd be helpful if everybody can mute themselves. That'd be really good. Thank you.
Yeah, Michael, if you're having difficulty focusing on the presentation, Michael would ask that you would leave. Thank you, because you are being recorded.
I'm sorry, I have PTSD from the war.
Okay.
Okay. And so so the person on the left, Ian Diamond, and the person on the right is the Chief Medical Officer for Scotland, Gregor Smith. And both of them, the sentiment was very much that actually we can do an enormous amount of good if we actually use the data that we already have and allowed it to be connected. But we've got to do that in the right way. And that requires an ethical, privacy-enhanced data sharing. And I guess this is what we've
so many things I regret in Vietnam.
This is what we've been tasked with in Research Data Scotland, because I guess more broadly the big challenges for society and for government are things that are quite messy. They're things that require a lot of different organizations to work together, and that requires not only a collaboration of people, it requires collaboration on the evidence and the data to really understand the causes of problems and understand what we do in order to address them, and actually whether the changes, the policies, the operational sort of things that we put in place to resolve those are actually working or not. And so this is where I think data linkage can really make a big difference, particularly around I've shown here the Commission on Future Delivery of Services, also known as the Christie Commission, really proposed a shift towards a preventative set of public services with a focus on performance and partnership, and people working across health and social care or different elements of health are really this is where I feel that data linkage can make a massive difference. So, I mean, and I guess the other thing for us is here is that this isn't just improving the public good and through the direct improving well-being of individuals by better quality services. That's an important part of this, but there's a real financial aspect to this as well, both in terms of the public sector.
Free Boris Johnson.
Because I feel that we can, the evidence suggests we can save a significant amount of money for the public sector and allow that to be spent on better things, and similarly for the economy as a whole, through attracting investment into Scotland and paying for high-paid jobs in data science and research, and particularly important now that in Scotland we've moved to a position where we're raising revenue in the exchequer as well as spending the revenue here in Scotland. But we know that there is still a significant problem here with access to data in particular, to make what the benefits that I've outlined a reality. And it's not just one organization. ABPI have been quite prominent in this, but a range of organizations have said, look, there's the problem here that needs addressing. And essentially, this is why Scottish Government decided to set up the organisation Research Data Scotland to tackle this. And Scottish Government have put in not insignificant amount of money into this. We're talking sort of a few £1 million each year over a 5-year period, and we're I suppose the context for this within health and care is around the ambitions that government have got were articulated in a data strategy that was published around a year ago. In fact, there's just been over the last week an update on this to show the progress that's been made. But essentially, this was all about how do we use data within the context of health and care services to improve direct care, to reduce sort of costs of using digital services, and to really drive innovation within the health and care services. And an important chapter where I've been involved is around supporting research and innovation. And a focus here is about how do we use sensitive case level data about a person to drive innovation in healthcare services. And there was 6 ambitions around this, which I can put up in the screen here. And actually, in fact, there's 7 ambitions. That's but out of those, Research Data Scotland, we're working very much in partnership with government on 5 of those 7, and I'm going to be talking about exactly how we're doing some of these things a wee bit later. I just wanted to, before getting into kind of where we are in Research Data Scotland, I just wanted to outline a specific example of what this means in practice. And it's around improving healthcare for people that are homeless. And so I suppose the story starts for me when I was working as the chief statistician in government, that we would publish some figures every year about homelessness in Scotland, and those numbers would go up. Some years they would come down, some years. Sorry, is Katie, I think Kyle's trying to get our attention here.
Sorry, what was that? Who's trying to get our attention?
I think Kyle there was waving.
Oh, Kyle. Can you please wait till the end rather than interrupting at the moment, please, Kyle? Can I ask questions at the end? Sorry, Roger. On you go.
Okay. So yeah, the story was that we published statistics on homelessness on an annual basis, and sometimes the numbers would go up, sometimes they would go down. Actually, organizing that data and putting many years worth of data together, what we realized that actually a significant number of the population, 8% of the population, had been homeless in the last 20 years. And what we, the inevitable question came was actually how's the life of people in that situation relative to others, and particularly looking at the healthcare of people that are homeless. And so what we did then, and so we, as a partnership between government and the University of Glasgow and NHS Fife, was linking data on homelessness with data on healthcare. And homelessness data comes from local government, healthcare from the NHS. And in doing that, what we could tell that there were significant barriers to healthcare for people that are homeless. And there's a whole range of quite depressing statistics on not only life expectancy and morbidity, but on barriers to healthcare for those people. And that was fine. That was some really good insights and sort of pointers to what could be possible in terms of reviewing healthcare services for homeless people. What that also did, in just bringing that analysis together, was identify particular predictive factors that pointed to whether somebody was likely to become homeless in the future or not, particularly around people that presented with alcohol, drug addiction, and mental health conditions, people that had lost or were there was nobody working in a household, and with domestic abuse as well. And bringing those data sets together, what we're able to do in that bit of work is look at the points at which individuals, or we'd identify on a collective basis that there were many points that would lead up to somebody becoming homeless, that there was an opportunity to intervene. And actually, with the support and the contribution of people working in local government and in the NHS, we're able to develop an intervention that was trialled in NHS 5, where if you presented to your GP, then there was some services that you could, or some essentially some questions that would do some risk prediction, and then a preventative intervention was available, which rather unsurprisingly, significantly reduced the chance of somebody becoming homeless, but also had a range of other benefits for that individual and for the wider society and for the exchequer as well. And the reason I've got a line in there with the green things on the bottom, the blue things at the top, is that actually it's important to remember in all of this, we can do some great data management, we can do some great analytics, but until you involve the people directly from the front line, from service management, from government, it won't actually lead to some of the positive changes that actually data driven innovation has the potential to do. So there's more to it than just analytics, which is where I think Research Data Scotland comes into this, because actually to get up to the blue line, you need to have hold of the data in the first place. To be able to do the analytics, you need the data in the first place. So actually getting the right framework, the right ecosystem for doing that is important. And this is why Research Data Scotland was set up with the ambition to really unlock the data and make it available in a much more straightforward way for research in the public good. And so that's our role, to provide leadership to others in that space. And so our focus, just to be clear, is not just on health and care data, though that's a really vital part of what we do. It's on all data about people, places, and businesses. Tend to be on sensitive data, sort of case level data, rather than aggregated data, though we are looking at how we bring in some aggregated data that's really useful. So index of multiple deprivation, or census data, or things like that are a more aggregate level. But I think the real value is in the sensitive case level data, including case level census data, for example. But what we don't do is generate or collect new data. We're really an organization that's about how do we make the most of the data that already exists. And we've got some fantastic data here in Scotland already. And it's just a case of making it available and connecting it around a person. And so that's our focus, is simplify and speed up the use of that data. And I guess this is what we've got in my mind by doing that, is that we're already working with lots of fantastic expertise from around Scotland, from around the UK, and lots of data that we have actually about people is in different places, and that makes it quite awkward here. So in particular, what we have here in Scotland is something called a safe haven, which down in England is called a trusted research environment, or secure data environment, SDE or TRE. And what this is, these organizations are really secure computer settings, and that operate to trusted arrangements. And I'll talk a little bit about them in a minute. And what our vision is in Research Data Scotland is to be able to connect all of these places, and to have common approaches and ways of accessing the data through a researcher access service that will allow you to see what data is available, and a relatively straightforward process for accessing the data. And I'll talk about that in a minute. But so that's our aim: connect data around a person, place, or business and make it available quickly. And so in doing that, the key thing for me is about demonstrating trustworthiness, because if we don't have the trust, the support of the public, of owners of data, and of others that are involved in the system, then we might as well pack up and go home, because all of this depends on public trust, because all the data that I'm talking about, the sensitive case level data, are things that people have willingly given as part of a service that they've received, as part of a survey, or like the census, for example, that they've completed. And ultimately we need to for operational delivery of services, rely upon those data being shared, and that there being trust that nobody can be identified from that data in the context of research here. And in doing that, the other sort of key part of this for me is widening the range of data sets that we have, and I'll say something about that. I mentioned that we were working to an internationally in these safe havens, to international best practice, and this is seen as something called the 5 Safes framework. And that was developed by the Office for National Statistics around 10-15 years ago, and it's based around these 5 things. So basically it says that actually it's all right to manage data securely in these settings, and what that means is it's only researchers that are trained and authorized to use data safely, so safe people, that the projects and the uses of data in these secure settings is only going to be where that's been approved of this projects in the public good. The settings themselves are an accredited environment with excellent security around them. That data is treated in ways that protect confidentiality. And that all of the outputs that come out of that really secure environment are screened and checked for disclosure, to make sure that nobody can be identified from that from the things that come out. So that's the 5 Safes framework that we work to, and basically we're working to the towards a model where if these 5 things hold, the data is effectively anonymized within that secure setting, and that's really helpful for speeding up and reducing the complexity of the data sharing arrangements that need to be in place. And we sometimes call it effective anonymization, sometimes call it functional anonymization. And what it means here, and I'm just going to talk through this a little bit, is that basically getting the diagram here shows that actually we're getting data in from a range of different places, from controllers, data controllers X, Y, and Z. So it might be from NHS Scotland, it might be from local government for social care, and it might be a study like Generation Scotland or something like that. And not that we've engaged with Generation Scotland quite yet, but and that those data controllers provide information to us, but the identifiers, individual identifiers like name, address, and other kind of identifiers like a KI number, or for example in the context of health, are taken out of that data set by a third party, and we use the National Records of Scotland to do that, because they have a register of births, deaths, and the population that they use for things like the census. and what they can do is provide an ID that's not known to anyone else working in the system, that's common across data sets. And then that can then be put into this national safe haven, the secure computing environment that I mentioned earlier on. And then when there's a particular request for data, so this is this national safe haven, the third box down, with this identifier, common identifier across the different data sets. And then when there's a particular request that comes in, if it's an approved researcher, if it's research in the public good, then that data will be put into a specific place for that researcher. So, or research team, in fact, which is often equally as important. And then I mentioned that the final box at the bottom is that outputs are only released once they're de-identified. So that's the sort of basic governance model here of how we're going to be able to bring together data from a range of different sources, or how we've already started to do that, and how we make this work. And another part of this is clearly, I mentioned the trustworthiness and demonstrating trustworthiness. So the key part of how we work is working with the public and embedding public engagement as in all we do. And basically the public, the broad message is that actually they want the data to be used to improve public service. They expect the data to be used to improve public services, as long as that's done in ways that don't identify them, and they can trust that data is held really securely, that the research is done only if it's in the public interest, and that they're able to at any time see who's accessed their data for what purpose, and so that transparency is a really important aspect of trust. So those three things, if those conditions are met, then the public is absolutely behind, and in fact is more than behind, expects the public sector to be using data to support improvement in services and discover new treatments and all of this. So how are we making this real now within Research Data Scotland? So we've got a new service that's launched relatively recently. It's called the Researcher Access Service, and this helps a researcher that comes along with a question. I want to do some research on whatever it might be, and it helps the researcher discover data, discover what, is there any data that can help me with my research question or analytical question, and then work through to get approvals to make sure that those 5 safes are met that I described earlier on, and then to put the data into a suitable place for the researcher or for the research team to work on it and to get that data out. So that's the basic model. And what we did last year was we focused on the first stage. So developed a metadata catalog, which basically has the list of data sets that are available and the details of those data sets. We developed an online inquiry form, and over the last 12 months, we've been digitizing the process, trying to simplify the end-to-end process, cutting out quite a few of the steps, and essentially we launched that relatively recently, the Researcher Access Service, and then we've started that in a relatively straightforward kind of way, and I'll talk about that in a second, just to make sure that actually all of that end-to-end process is working well, and that it is doing the things we said that it was going to do, which is to speed up and make more reliable the access to data. And then over the next year, we're looking to to broaden that so that covers a much wider range of data, a much wider range of and complexity of research. So that's where we're heading, because to start off with, our focus is just on 9 data sets, and we've got quite a number waiting in the wings, because there's something like 40 data sets, and I'll talk about those in a minute, that are available through our national safe haven in Scotland. But the 9 that we're focusing on at the moment are things that we know are really popular, and we're expecting, and we're already started to get a lot of queries and projects starting up focused on these things. So you see, they're all sort of health focused. I've got long time series here as well. And we're expecting further data sets to then come in over this year. And so basically, if you're interested in and you've got some research that you think, or some analytical work that you think might be delivered through access to these data, and this data covers the whole of Scotland, just to be clear. If there are things that you feel you've got there, then we come in, and I've got the link at the bottom to access our inquiry form, and then we can take it from there. We're working with Public Health Scotland, and they've essentially got a group of research coordinators who will take you through that whole process, from your initial interest to deciding exactly what data you want, to making that available in a secure setting for you. And yeah, is there a cost? Well, there is, and it differs for different groups of people. For some reason, I've just chosen the academia and charities here. There's if you work in the NHS or in a public body, it's less than this. If you work in a private company, then it's more than this. But it's just an indication of the kind of cost, and that's really just to cover our costs in bringing this stuff together. So that's where we are at the moment, but we want to significantly improve the efficiency. We think we can go a lot faster. So up until the point before this researcher access service started, it took something like a year on average for this. It was getting them for a year anyway. From you coming with an idea for a research project to the data actually being in front of you. Not even the time, it's not a year from that research being done, it's a year from being able to start the research. And so we think the researcher access service should take much less time than that. We should think we're talking in terms of weeks, rather than year, but I think we can go even further than that. And so we've got a bit of work looking at how we cut out steps of that. We don't want to take away from the security and the things the public expect to happen, but we think there are still ways that we can make the process more efficient, in particular to move to this process of effective anonymization of the data, and so we need to get on with that. The other thing that we are just working on at the moment is around synthetic data. So synthetic data is like a copy of a real data set, but it's and it follows the same format. It's got the same variables in it, but it's generated at random. So it's completely made up individuals, but it has pretty much the same structure as the real data. And the real advantage of that is that we can make that available to registered users of our services, that they can get on and have a look at immediately, so they can kind of refine the ask of the real data. They can develop code, and so that when the approvals happens for the real data, that actually the analysis of the data sets becomes a much shorter process. So we've got a tool that we've inherited to do that, which is called SynthPop. It's an R-based synthetic data generation tool that's free to use and download, and that we've funded some work to, because there are slightly different ways of tackling and generating synthetic data. We've been funding some ideas about what best practice looks like this, that we want to bring into a synthetic data service over the coming year. An important data set, and so I just want to say something about the data sets that we've got available. So not in the 9 data sets that I mentioned earlier on, but clearly a massively important data set in terms of health and care is around is imaging data, and combination of Public Health Scotland and the University of Dundee have over the last 5 years made massive strides into getting and making available for research. So putting into a format that researchers can actually use lots of imaging data. I mean, so we're talking, PET scans, CT scans, a range of other sort of X-ray based scans as well that are available. I think there's something like 28 million scans that are available through this service just now, and that but actually it's been really hard getting it to the place that it's in now, which is a service that launched a couple of years ago, and so this year we're looking at how do we broaden the range of modalities that are available. And currently the data exists up to the end of 2017, and we're looking about how do we bring that up to date and keep that updated, because these are a really big data set, but a massively valuable data set if you can then link it into some of the other health data sets that I showed earlier on. So that's Scottish Medical Imaging is available, and you'd apply in the same way for that, but we haven't brought that into the researcher access service, so access to this does take a little bit of time just now. And then where are we going much more broadly with data? Well, clearly a big data set in the context of health research is GP and GP practice data, and this has been particularly tricky to make available. There's been a few attempts at doing this that have moved things a little bit, but not really got there. There's some data that's certainly available for Lothian at the moment, but not for the whole of Scotland. So currently working, and it's really supporting a project that's been led by National Services Scotland and the Scottish Government to make GP data available for a range of purposes, of one of which being research. But we're hoping that by the end of this year that we'll have some data from GP practice about what happens during appointments and some demographic information about people as well. And that will really be transformative in terms of the health research landscape. I think there will definitely be a more complex process of accessing that, and GPs quite rightly are, as they're the data controllers for their own GP practice data, they're more nervous about the use of that data. Many people are, so it's quite right that they want to have an additional layer of scrutiny over what happens to that data for research purposes, which has just been put in place at the moment, and that's why it's taking a little bit of time to get that up. We're also expected to bring some new data around diabetes in this year, but also some more prescribing, because we know that not all prescribing happens in the community, and this should give us a much better, richer picture. And then in future, that we're working with Scottish Government on both genomics data, on data from testing in NHS laboratories, and then a range of other other kind of research, existing research sort of studies, and being able to link these things collectively together. I think the work on genomics and on laboratories is going to take a bit of time. There's quite a bit of sorting out of the underlying data sets that needs to happen, as well as the complexities that exist in the data sets. Will just take a bit of time to work out in the way that it did for medical imaging, for other for genomics. It'll take a while to really get that service up and running, I'm pretty sure. But we've got a range of other sort of ambitions beyond healthcare as well. And one that's not mentioned on here, I don't think, is social care. And we're I'll just say we're working closely with government and Public Health Scotland on this. There's some things also that need sorting out with the data sets on social care before we can make use of them. But with all of these things, we want to be in the room and showing that there's a path to using these for research as well as for other things. So that's our plans around data. And yeah, I've just got a couple of things to mention just before I finish, and want to have some time for questions. So in fact, I won't say too much about this, only that we've already established a protected characteristics data set, drawing together data from a range of different places, and that's to improve the quality and reduce the bias that exists in the data from any individual source of data, but to help and support research to be done not just for the population as a whole, but to really understand the effects of things for different groups within our population. One of the things that I mentioned right at the start was the goal about connecting data from different areas, and what we've done. I mentioned these safe haven areas, these 5 safe havens across Scotland, including our national safe haven, and the safe havens are essentially partnerships between NHS and academic institutions in Aberdeen, Glasgow, Dundee, and Edinburgh. And what exists at the moment is slightly different arrangements for access to data across these different centres. But what we want, and connecting data from Glasgow and Edinburgh, say, is remarkably difficult at the moment. So we're working with the fantastic expertise that exists already in those centres to essentially see what we can do to move together to a more coherent system and service for researchers. So I would hope that in future we're going to be able to have one way into to access to data across these different places, to make data discovery across them more straightforward, and to be able to bring data together from the different parts of Scotland that can really add to the kind of research that we can do. And what we're doing as an initial way into that is developing something called a Safe Haven Charter, which will set standards and make sure that we've got common standards, policies, and approaches across the whole of Scotland. But this will take a little bit of time to work through, and it will also take a significant amount of trust in the system, and this is from the different data owners, and that's why having a common set of policies that we operate nationally is going to be an absolutely vital element of that. But like I say, I think it's going to take a bit of time. And that also goes for working with industry. I know that this is quite significant, clearly within the space of healthcare research. And again, there's no consistent arrangements across Scotland. So we're working with those safe havens that I mentioned with Scottish Government, and then with some other places as well, to essentially develop a draft operational policy. And we've got that draft at the moment. And what we're going to looking to do this year is to test that by running some pilot projects with industry over the second half of the year, and to do some engagement about actually if industry is going to access your data, public sector data, then how's that going to happen? What are the limits on that? Because we're quite clear from the public that the guiding principle is this going to improve the lives of people in Scotland? And if it's not, then it won't happen. But beyond that, there's some questions that need to be asked, such as, are you going to allow companies from abroad to come in, other particular kinds of companies that because of who they are, you're not going to allow access? Well, I think some of these things need teasing out. And for me, the guiding principle is this in the public good rather than who accesses it? But I'm one view, and there's a range of other views that we need to hear first of all. So we're going to be doing focusing on that this year, and a final thing that we I think I'll mention is around cohort discovery. So a lot of, I don't know whether anybody's involved here in clinical trials, but one of the most important things there is trying to find who's your sort of cohort. Is there enough people within a particular area? How big is the area that you need to do? How do we kind of set up our trial group and control groups? And what we're doing, working with Health Data Research UK, the University of Dundee and Public Health Scotland, is to develop a tool so that we can bring data together from across Scotland to quickly answer that question. It allow people to select particular conditions or particular age groups or other demographics that will then say, well, how many people, where are they in the country, in order to be able to provide a more instant result and help define these cohorts that are really useful in clinical trials. So mapping that, so we're currently, in order to do that, we've got to get the data on a common basis, and that's going to take a little bit of time, but we're expecting that to be sorted out by the autumn and to launch that service later on during the year. So that's kind of what I wanted to say. Our focus in Research Data Scotland is on that faster, more efficient access to data for research in the public good, and doing that, we're developing new researcher services. So we've launched our first researcher access service. We're developing that. We've got those new information governance approaches, and getting we've got support from the big data owners within that: government, National Records of Scotland, Public Health Scotland, that we're going to take wider and bring in a wider set of data sets, unlock a wider set of data sets, and then develop new services like synthetic data, like that cohort discovery tool, standardize and align approaches, like I mentioned, with industry there, by engaging the public, continually demonstrating the trustworthiness in all that we do and our partners do. And I think through that, what we should be able to do is create a sustainable system for access to data for research in the public good. We should be able to encourage new treatments. We should encourage faster development of innovation, and hopefully, from a government's point of view, tell them whether the policies are actually working or not, and whether they were a good thing to do in the first place. So I'll leave it there, and then we've got a couple of questions. You might have see there's a set of things that have come out in the chat, and so happy to work through those or to answer the questions on the screen and get your views.
Thank you, Roger. That was fantastic, and I thank you for surviving our heckler. Not had a heckler on before. And thank you to Mike Hurst and Sharon for helping to sort that out as well. Francois came in with the first question, and he's hoping to do projects around perioperative risk estimation. He's excited about safe haven approach, and I'm excited that you're talking weeks rather than months now when it's actually available. But he's asking about the difficulty of getting the data he needs, which is on digital paper and basically PDFs. And he knows that you can use natural language processing and large language modeling to facilitate that and avoid the patient's identifiable information. But is there any plans to help with that in amongst what you have?
I'd say it's worth a conversation with us. I mean, I think that what we will enable is people to bring their own data. I think I haven't really kind of thought about what we can do to directly help with it. We've been involved with, I mean, there's some projects, for example, one with one of our partners did that sort of essentially moved from kind of locked formats like you were describing there with PDF to usable formats, which was around births, deaths, marriage records over the last 200 years, digitized, and now that's in data sets that can be available for research. So very happy to have a conversation about it. Whether we haven't done that as a service yet, but that's an interesting one. I'm very happy, Francois, if you want to follow up with me on that.
Charlene's particularly interested in the information governance side of things. Not to really discuss it on this call because we're short of time, but she says, who should she contact for further information around information governance of accessing the data sets?
Well, I suppose I've got two answers for you there. And I think if you're interested in using or sort of connecting some of the data that you've got in with things that we can do in Research Data Scotland, more than happy to help and advise about that. And so I would just get in touch via our website on that, info@researchdata.scot. The other aspect, the thing that I would suggest is that there's an existing panel that looks at these things and has got called the Public Benefit and Privacy Panel, and so and I think they might be able to advise if there was if you're kind of unsure if it was to do with about data sharing, then I think that might be a route for doing that. So I would I could I'm just trying to think about what I can do to I would just go and look that up. You'll be able to find a contact.
Get in touch. Yeah. Ashok is asking, Roger, you mentioned R. Are you using any other tools and programming languages to interrogate your data and produce management reports?
Well, I suppose I'd say that our role, sorry, I probably wasn't quite clear. I suppose our role is that we're a data services organization. So our role is to unlock the data, to get it out of a system in the health service or in local government, and get it into the secure computing environment and in a format that you can access. So there's two parts to this: is what tools are available for researchers in that environment, and what tools do we use? So we just use R basically to do all of our work, and you know, none of it is dramatically complex that that's not good enough. But in terms of the tools that are available in the secure computing environment, there's open source tools like R and Python. There are ability to use to bring a license of tools like SAS and SPSS, but also GIS tools like ArcGIS and equivalent. Trying to remember the name of it, but the equivalent open source tools as well. So there's a range of these things.
Yeah. Charlene's followed up on the information governance and says, is there an information governance lead that can help in relation to the arrangements?
Yeah, and so I would say our information governance lead is somebody called Kate McBay. So I would so her email will be kate.mcbay@researchdata.scot.
MCBEY or BAY?
MCBAY.
Yep. And Sharon's come in with any plans to integrate with third sector organisations. You did mention about some social care.
Yeah, I've definitely got this in our sights. I think that yeah, but what would I say? Maybe not immediately. I think there is a lot of I mentioned all the data sets that we've got there, and social care data sets are well, and I'm going from my understanding a little while back, that there's a lot to do in terms of the standardization of those and to actually make them usable as research data sets. And so we're working with government to do that. What we haven't done is engage directly with the social care providers, and we're kind of leaving that to Government and Public Health Scotland to do, to sort of leverage the data out of those that then can be aggregated nationally, I think is the approach that we're taking.
Yeah, it's fascinating to see how things have moved on. You've achieved a lot over not very much time. It seems, the number of data sets that you're managing to get into and to link is tremendous. Really impressive.
Well, we're still got quite a long way to go, Katie. I mean, but I'm pleased with that we've actually got a service up and running. And I'm pleased with the progress that we've made and the support that we've been getting from data owners. As I've definitely been in situations over the last 10 years where I've been told to get lost by a data owner because either they think it's too risky or they haven't got the time. And now we've got a bit of resource that we can help with contributing to their time. And actually, if Scottish Government are doing this, if National Records of Scotland are doing this, if Public Health Scotland and others are doing this, then yeah, actually, I can see that people can start to see the benefits, and particularly as the range of data sets mounts up, there's a cumulative effect of benefit there for people.
Yeah, Francois has followed up and said really need to be able to open up the different tools which are currently blocked by NHS-IT, would make things easier as well. Roger, that's been a fascinating hour. Thank you so much for your time. We'll have to get you back in another couple of years' time because things will have moved on hugely again. But I'm proud that it's happening in Scotland. And I think it's tremendous. And I do hope there's a role for British Computer Society Health and Care in Scotland and the exec more widely in the UK. To link in, because like yourselves, for the benefit of Scotland, we're all about making IT good for society. So thank you once again, folks. I hope you'll join us for Counter Fraud Talk on the 28th of May. The information will be going up on our site just shortly. But thank you for coming along, and once again, my apologies for the earlier interruptions that we had. And thanks to Mike and Sharon for helping. With that, thanks folks, and cheerio.